Back with more of Ask the Expert. Scott Watson's here from Watson's Pharmacy and Wellness Center. If you'd like to give us a phone call, 613-789-6559, extension 2803, or ottawa.morning@ctv.ca is the email address. You can also have Facebook as a question. All right, Scott, we do have a couple questions today.
That's good.
Heather is first on the phone this morning. Heather, how are you?
I'm good.
Very good. What's your question today?
How can I help, Heather?
I take loxapine,
Okay.
and I seem to be breaking out more from it.
Have you
And I
just
was wondering
started
if
the
that's a
medicine?
normal reaction to it.
Have you just started taking the loxapine?
I started taking it in July, and it's been since July that it's been progressively getting worse.
Well, loxapine can have some interesting effects, and what I've seen with most medicines is that they do have an effect on skin, and it's possible that it could be. Now, it doesn't have to be. It's one of these things where I know that doctors will work on these things with patients depending on exactly how bad the skin condition is. So it's possible, but I just want to say that it doesn't necessarily show that it is the loxapine, so it's just possible.
Mm-hmm.
Okay?
What is loxapine for?
Loxapine is for mood, and but it can have an effect on various things with our body, and sleep is one.
That's one thing people should be aware of when they're prescribed drugs or what have you. There are often side effects that they should consider, right?
There is, and I mean, as a pharmacist, you kind of learn about 3 or 4 big ones for each of the medicines. But if you look through the list, there's about 50 side effects for each drug in the tests over thousands and thousands of people.
And there are possibilities more than anything.
Possibilities,
right?
That's right. So it's not necessarily, but it could happen, that's right.
It makes me, it's kind of funny in an odd way to listen to some commercials in the United States where you hear them talk about in the fastest voices known to man, all the potential side effects.
That's right.
That go with drugs, which I guess they're legally bound to do if you're going to advertise on television for drugs, right?
That's right.
So you have to list all of the possible side effects.
And they have to speak pretty fast to get them all in. That's for
you
sure.
got to be paying attention to know that stuff.
That's right.
Yeah. Natalie's on the telephone. Hi, Natalie. How are you?
I'm good. How are you guys?
I'm good. Good. Is your back sore?
It is indeed. I've been seeing a chiro. I've seen physiotherapists. I've been stretching, and nothing seems to be helping. Is there anything I can do to rectify this?
You know, getting rid of back pain is just one of the hardest things to do, and I think it's a combination of activities that people will do to actually get rid of the back pain. It's rest, and that's a very good thing.
Right.
Then a combination of physiotherapy and being active, I think that's also very good. Doing things like swimming. I know that's not the greatest time in the year to be swimming, but swimming is very, very good for lower back pain because it's going to help with the stomach muscles. And then also sometimes people will need anti-inflammatories because there could be an inflammation there that is causing some of that pain. Mm-hmm. And so just working with your doctor to get an anti-inflammatory that works for you. Right. And there could be, like we have made some topical transdermal formulations of things like Advil or
transdermal means goes through the skin.
That's right. Special creams that we make up in our lab that can help with lower back pain.
Right.
For sure.
Right.
Absolutely.
Now, I mean, everybody's different when it comes to their back issues.
Absolutely.
Right. So it could be any number of things.
You need to work with your health practitioner, either a chiropractor or your doctor, to figure out exactly what the problem is, if it's a spinal injury, if it's a muscle injury,
right.
And then just work to rectify that. So there's many, many ways to do that.
Right. Have you sat down as a pharmacist and try and come up with different compounds for different ailments and that sort of thing? Like you sit there and pick a little of this, a little of that, like it's a recipe sort of thing?
Absolutely. We sometimes the doctor will say, I've tried this, but it just doesn't seem to be working. And then, so that's where this little artistic component comes to, where you kind of learn about different types of medicines, different anti-inflammatories, different types of pain relievers that could be incorporated.
Yeah, because they just, sometimes they don't work for people, right?
And
the over-the-counter stuff especially.
Absolutely, and the compounding is wonderful just because it gives you all these different alternatives that can be made. So.
Yeah, so in Natalie's case, you might have Natalie come in to see you. She might bring along the medicine she's taking, whatever that might be.
That's right.
right? And she tells you it's not working. So you look at this and then try and come up with a derivative of that, or?
Absolutely. We could come up with, I mean, so through courses that we learn about different types of pain-relieving medicines. We could go back to the doctor and say there's these possibilities that you could prescribe for your patient as well.
Right.
And then, it's totally up to the doctor, but it's an alternative that they may not have thought of. So, so it's a nice thing.
Are people surprised when they find out that you're one of those few people who still do this sort of thing?
They are. People will often say it's so nice to see a small type pharmacy that's doing these things that pharmacists used to do long times ago.
Right.
Yeah.
But the bottom line is, it's effective.
It is, and it's presenting alternatives. I mean, the commercial companies are doing a good job of treating the whole market, but the compounding pharmacies, we're just kind of picking up where those pieces don't cover.
We'll take another break. Apparently we have lots of questions waiting after the break. That's good news. Scott Watson from Watson's Pharmacy and Wellness Center. 613-789-6559, extension 2803. There's the email, there's the Facebook. Get on it, and we'll get to our third segment coming up next.